Hi there, it's Erin here with Nutrition by Erin, and I'm so excited today to interview Dr. Darrell Kilcup. I met him last year as part of my mentoring program, and he's located in Phoenix, Arizona. He's a chiropractor, but has a functional medicine background, and so he's going to give us some insight into how he uses some of his teachings and his background to help people improve their gut health. So a little bit more about Darrell before we get started. He has been practicing for over 25 years, so he's quite the specialist, and he has an in-person and a virtual practice. So if you want to see him in person, you do have to go out to Phoenix, but he does do Skype appointments too, so check that out. And in 2013, he did the functional medicine training program. So he's now a certified functional medicine practitioner, and he helps patients with all kinds of issues ranging from chronic infections, cardiovascular disease, autoimmune diseases, gut problems, fatigue, hormone issues, you name it, he knows about it. So let's go into the interview and get started. Okay, Dr. Kilcup, thanks again for coming to your office and sitting with me today. So I kind of wanted to start just kind of hearing from a chiropractor's standpoint rather than nutrition. How have you used your teachings to help people with gut issues?
Yeah, the approach that I take to gut issues is the same approach that I use with everything. I don't have a script. I actually have to figure out what's wrong if I'm going to get a patient out of pain, if I'm going to get a patient's gut working right. I can't give them a medication that's going to have some overriding effect. We really need to figure out what is wrong before we can fix it. So gut issues lend themselves very strongly to that, because unless you figure out what's wrong and what needs to get corrected, you aren't going to get any positive results at all. So it's been a really nice match for me.
Okay. So it's almost like you're the mechanic, and if you take your car to the mechanic and you're just like, put some oil in it, it might not really get to the root cause. So you're going to try and do some investigation. Now, I know you probably see a wide range of different patients come into your office, but what would you say is like the percentage that you have to go ahead and start with the gut or target the gut initially?
Well, it's rare that we don't.
Yeah.
It's usually one of the most common. I would think that most times, unless it's an infection of some kind, like Lyme disease or mold toxicity, or like a virus like Epstein-Barr, most problems begin in the gut.
Mm-hmm. Very wise, very wise. So in order to try and figure out what's going on with someone's gut, because obviously they could come in with already a diagnosis, or maybe not, they've just been suffering. So what kind of tools, or how do you get started trying to identify the root cause?
Yeah, I have a real passion to find objective scientific answers for patients. So often, even when they've been to places that are famous for healthcare, they don't get good objective testing. So when it comes to gastrointestinal health, one of my absolute favorite tests that we run here are stool analysis, where the patient actually collects their stool, we send it into a lab, and they analyze it in every way you can imagine. You never knew you could find out so much from a person's stool, but it is absolutely amazing. And very, very often this test will get us going in the right direction, because it'll show us, where the problems are really at.
Okay. Now the stool test, do you have a specific one that you use? Is it with a certain company? Can you tell us a little bit more about this test?
Yeah, well, the lab that I use for stool testing is Doctors Data, and they are a big lab and they do lots of tests. And there are a lot of different stool tests that we can run. Usually when a patient comes in and we're not sure exactly what's going on, we run a comprehensive parasitology stool examination. So it checks for good probiotics, bad bugs, checks for things like yeast, parasites, digestive markers, inflammation markers. all kinds of things that will tell us, what's wrong inside that gut.
So you're kind of getting just the full spectrum report. Then from there, do you have to, like, once you get maybe some marker that's out of whack, do you do any kind of follow-up testing, or can you just work from that starting point?
Really just depends on what we find initially. Like, can I give you an example here of one?
Yeah, please do.
All right. So here's one we had recently. This is a stool analysis, and this patient had very similar complaints that most people with GI distress have: cramps, bloating, diarrhea, fatigue. And you can see there on the left are the good beneficial flora. And I'm sure you're well aware that we should have Bifidobacterium at 4+, which is the highest it can be on a test. And this patient had none, 0, none grew. And Lactobacillus was at 1. And then if we go down, the other thing that was really fascinating on this test, this patient had no parasites, but this patient wasn't digesting fat. And when they checked for fat in the stool, they had a lot of fat. So this is not a common finding that I see. And in this patient, we obviously needed to make sure that we got their probiotic count up, and we needed to help them figure out why they weren't digesting fat. So on this patient, we would probably have followed up with a test there on the fat, the digestion markers, to make sure that we had corrected that. So that's one example.
Very interesting. So do you think that there was any correlation between the probiotics and the fat malabsorption? Was there maybe something going on, like with the diet, or any kind of other root cause to both of those findings?
The root cause in this particular patient was more liver, gallbladder.
Okay.
The low probiotic count definitely was causing lots of problems. As you well know, these probiotics are basically like an organ. They're actually making vitamins. They're part of the immune system. They're helping with absorption. But when it's this bad, when we see fat in the stool at this rate, it means their gallbladder and maybe their stomach hydrochloric acid production is just poor. And we needed to get that working.
Did you say you had another example for us?
Yeah, I do. I got 4. I'll go through them real quick.
Sure.
Here's a stool analysis. And again, on the left side, you can see this patient had very low count Bifidobacterium and Lactobacillus. But the patient also had very bad pathogen on the right side, the 4+. I won't embarrass myself and try to pronounce it. But, this bug will definitely wreak havoc and make a person very sick. You can also see that the microscopic yeast exam found a few yeast. And then this patient, elastase, which is a pancreatic enzyme, was low. So the patient wasn't digesting proteins very well. And his gut was very inflamed. So these inflammation markers, lactoferrin, calciponin, and lysozymes, were all elevated. And I just got and you can see the secretory A, which is part of the immune system, was also very low. We just got this patient's retest back. He's like transformed into a new guy. It took about a month, and he's thrilled. And it looked almost completely better. So really, really great turnaround on him.
Now, on that patient, was your primary concern addressing the pathogen, and then things almost corrected themselves, or did you have to do other sorts of interventions?
I did both. Usually when the patients come to me, they are just at their wit's end.
Mm-hmm.
And for them to go slow and steady and, drag this out, they're usually not interested in that at all.
Mm-hmm.
So I'll hit them with good probiotics. This patient definitely treated the infection. I gave him things to help with his digestion, and I gave him things to calm down the inflammation in his gut. And so once we get things turned around, he's feeling better, then we can cut way back on the treatment.
Mm-hmm. Okay.
And then the third one, real quick, you can see kind of a theme here. This one, the probiotics weren't too bad, but we had a pretty bad infection.
Mm-hmm.
And we had some candida. I don't like any candida in there if it grows out. It's just a matter of how much until it's a problem.
Mm-hmm.
And then, bam, we had a parasite.
Interesting.
Yeah. And so not good. You can see, oh, that's right. And this patient also was not digesting carbohydrates, which is crazy. And the lysosomes were elevated. So you can see, I would never have guessed it. Give me 100 guesses. I would not have picked these combinations of problems
Yeah.
For this patient.
Yeah. Interesting. Right.
Very. Isn't that cool? And then the last one, listen to us. Isn't that cool?
Super cool.
This last patient, again, you can see very low probiotic counts, a little bit of yeast, and then again, a parasite, pretty bad parasitic infection. This particular patient was a young mom, and the whole journey that she ended up in my office was that her baby was having blood in his diapers.
Mm-hmm.
And we are currently waiting to get a stool analysis from the baby to see if perhaps that parasite somehow got transferred to him.
Oh, no.
So, again, I never would have guessed in this patient we would have had parasitic infections or even low probiotic counts. So that just gives you an example of a lot of the different findings that we see on these stool analysis.
Yeah. And I mean, it kind of, your patients are probably so grateful that you're really able to attack the problem versus like, let's try this 2 months later, let's try that. Cause that can be very fatiguing for both parties. And no one wants to go through that. So it's really great that you're getting targeted therapy and probably much better results with this.
Mm-hmm. Yeah, we do expect good results once we can nail it down that well.
Now, how does this specific test from doctor's data, like how does this compare to some of the other stool tests on the market? Or are you aware of some of the other tests?
I'm only aware of the ones that I would order. They are one of the best labs in the country.
Okay.
There are other good labs, and I've used them. This is the test. I've done a lot of stool, and I was looking back before our talk at all the stool analysis we've done. I couldn't believe how many we've done. So I've just gotten comfortable with this lab and can interpret the findings pretty well since we've seen them often.
Okay. Yeah, because I know a lot of practitioners use, you're right. They do get comfortable with maybe one company and maybe the way the results are presented. So I just wasn't sure if there were maybe some pros and cons to the different tests and or the technology that they're using to analyze the tests. I know I've been using Genova's stool analysis, so not sure if you knew of that one.
Yep, we've definitely done Genova, and I think they're great. And if there's something specifically that Genova is better at, I'll use them. And it's, as you know, it's constantly changing. One lab will up the other one and some kind of widget they'll have. So, it's always in flux.
Yes. Okay. So let's see. If you are maybe just someone who's suffering, maybe you're not working with a practitioner right now, is there any way that you as a patient can get your hands on these tests, or do you have to go through a health practitioner?
I don't know for sure the answer to that, but I would recommend if you're going to go to the expense of getting these tests done, it would be foolish not to have somebody who knows what these results mean, knows what to do with the results. You can monkey around, even if you got the test results, but you didn't know what to do with, a parasite. What should you do? What works?
Yeah.
You can you can do a lot of things before you do what's right. Whereas someone like myself and yourself, we see these things often, we treat them often, we know what works. So if it gets to the point where you're really ready to test for something, it just makes all the sense in the world to have somebody who knows what test to order, who knows what the results mean, and can not waste your money doing it.
Yeah, I definitely agree with you there, because it's not always so straightforward as much as we would like it to be. It rarely is. So I agree with you. Now, are there any other, just briefly, are there any other maybe popular GI tests that you're using with a lot of your patients, or things that, may not be a test, but maybe some road that you go down to help diagnose?
Yeah, absolutely. So stool is one of the most common, obviously, breath testing for SIBO, hydrogen and methane. Breath testing. I just came across a new test I'm still vetting and trying to figure out that uses a blood test to diagnose SIBO from Cyrex Labs.
Oh, okay.
Yeah. So I'm still trying to figure out if that's going to be the next thing to do for that. We do food sensitivity testing. We do a little test called an indican test that you can do a standalone indican test. It's inexpensive. Patient does it at home, and it can be suggestive of SIBO. So we'll use it as a screen often. And we also do a test called leaky gut testing, and that's from a lab called Cyrex. And sometimes we have to do it through Genova, but to see if a patient's gut is functioning normally or if it's leaking.
Okay. So you have a full toolkit there to help investigate. Last question for you about this. So on average, because of course we always want to be mindful of people's expenses, how much do you think people end up paying to maybe get one or even a couple of these tests done?
Yeah, the stool analysis ranges in price from probably on the low end 200 to the upper end 500, depending on how comprehensive the test is. And, Aaron, often I'll get patients who aren't rich. They don't have a lot of money to spend. And I'll say, you really need probably $1,000 worth of testing to really diagnose this thing and find out what is wrong and what isn't wrong and figure it out. And when we can't do that, we just start with what the patient can afford. We'll run one test, we'll get the results, we'll work on those results until that problem is resolved, and then we'll move on to the next test. So yeah, I've been absolutely humbled by patients who are sick, who are willing to spend their own money. Insurance doesn't cover this, and work their way through it and get well, when they don't have a lot of money to spend. It's been an amazing thing to be a part of.
Yeah, definitely. I see that it's unfortunate, but sometimes people do have to get to that place of being a little desperate to, spend a couple hundred, even if it's not ideal, but to then get the quickest results, get really to the root cause of the problem rather than waste years and different specialists and, that whole headache. So, you always have to weigh what it's worth to you,
right.
And hopefully make a wise decision there.
Right.
Now, is there anything else you want to add about this topic of gut health and some tests that we haven't discussed yet?
Well, gut health is really important. And I would say to anyone out there suffering with a chronic problem is one of the best places you can look to first is your gut. If your gut doesn't work right, you can eat fantastic. You may not be assimilating nutrients like we showed on those stool analysis. The patient that wasn't absorbing fat could have been eating the most healthy fats, and we're going right through them. So, making sure that digestion's right, making sure that there's no infections in the gut is a wise starting place for almost any chronic condition.
Yeah, definitely agree with you there. All right. Well, if we want to learn more about you and your practice, is there any way we can stay in touch?
Yeah, it's real easy. If you just Google my name, Darrell Kilcup, Kilcup, you'll find me.
We'll find you. And are you on Facebook or Twitter or
Yep, we're on
Instagram?
Facebook and Twitter, and Instagram, and Pinterest, and
You're everywhere.
and
Okay.
all those things. Yeah.
All right, cool. Well, I like following your Instagram, and Dr. Kilcup has a nice sized family of 10, right?
Yep.
So he's always doing active things with his family and posting some cute pictures. So we do stay in touch virtually. And maybe one day I'll go out there and meet you in person.
That'd be great. Yeah.
All right. Well, thank you again for taking time today to answer some of my questions about this topic, and I appreciate it. Any last words, or call it a day?
I think you covered it all really well.
All right. Thanks again.
Okay.
Bye.
Bye-bye.